update on my gallbladder removal. I was retaining a lot of water in my stomach area. 3 of the holes are healing up nicely. I had to go back and get stitches on the 4th one here. But it seems to be looking okay. These have to stand until they fall off. They look kind of gross, but that's the way the doctor said because it has stitches underneath it. But these are doing really well. This one's still quite tender. That's the belly button. And this one's getting this removed next week. We'll see how that goes in 5 days. But I'm feeling much better. It's much easier to sit down and stand up. Still a little uncomfortable eating food. Is sometimes difficult because you're getting gas buildup in your stomach now, much more than when you had your gallbladder, and that can be intense with some pain. But make sure you take your gas reducers, Gas X or something to get rid of it. If you don't, it's gonna hurt. So that's where we're at with the update. I'm doing pretty good, and hopefully next week I'll be doing much better. Thanks for following. And I got a couple bags of antibiotic and liquid. Came in for my stomach. Extremely bloated. What happened, they tell me what happened is when I got stitched up for my gallbladder removal, one of the incisions on my right side leaked, went back in. They went to the doctor's office. He stitched it up, which when you stitched it, the liquid was not clean from my body because it's pussing or whatever, oozing, so it's a dirty liquid. And when the needle went through the skin, you had a dirty liquid going into a clean skin, and then it created bacteria, which caused an infection. So they've had me on what they call a hot load of antibiotics, which is very strong. Going on and off for 7 days now. I'm going for another scan to see if I can clear to get out of here. See if the stuff is reducing the infection. If not, I could be here another 7 days. If it is reducing, they might let me go and take antibiotics orally or attach it onto your skin and it drips in at home, depending on which insurance will approve. Never thought having a gallbladder removal would be this much trouble. 2 weeks after surgery, or 3 days after surgery, I was having problems. And it went 2 weeks, and then the pain was on, off. I was like, I gotta get out of here, I gotta do something. Came to ER 2 times. Second time, one of the ER doctors looked at me, he's like, nah, you can't go nowhere, you're infected. So, or the infection is too bad, so I'm here. That's why I haven't posted any videos lately. It's kind of hard to do when you're stuck laying down. And my body's so sore. I don't know why, but it is. So, hospital food. Can't even eat today. It's just not a good feeling to be here. Alright, thanks for watching. Say a prayer for me if you pray. And I'll get back with you again soon. Take care. Been a little while since I posted a video. As you can see, in the hospital, they got me hooked up to all kinds of IVs and everything else. Sorry about that, dropped it. They found I had a colonoscopy done because I'm still having pain in my stomach when I ate after my gallbladder was removed. They found a mass in my large intestine, which is not a normal space, I guess, to find polyps or whatever. I don't know. But this one was small, and then when they looked at it again, it was like 4 times the size in a month. So it was growing very fast. I have the cancer doctor has contacted me to do some chemo. He's going to put a port in my shoulder, I guess, and he's going to take some bone marrow out of my hip to see if it's in my bones, because you can't see it, I guess. But my problem is that I have a colostomy bag here because they ended the large intestine, so I have small intestines, and then it goes to my bag because the large intestine is so infected by this disease that they had to give me a bag. Not something I really want, but if it's not functioning properly, what are you gonna do, you know? So my problem is I can't wait for my surgery for my colostomy incisions to heal, because if I wait 6 weeks for that to heal completely, I'm going to be too far out to have chemo, and then that sounds like it's going to be it, you know. So we're going to kind of push the issue with radiation. Chemo does not promote healing in my stomach and stuff, so it's going to create more damage before it heals. So I have to keep an eye on my incisions to make sure it doesn't fall apart while we're on chemo. Because once you start chemo, you really got to complete it to defeat lymphoma. Sorry, I'm having a hard time talking. My stomach really hurts. I had a cough after you have surgery because you get fluid in there and they want you to spit it up. And yesterday, I had a really bad coughing fit, and so it was so sore. So that's where I'm at. So I haven't posted any kind of videos at all. I don't know if my insurance covers any of this stuff, but I'm doing it because I want to stay alive. If I run a bill up to $1 billion, then I guess I run a bill up, figure out how to pay it later. Yeah, it's 3:30 in the morning. They just moved me up from the ER to a room. I'll keep you informed of what's happening as well as I can. Some days I'm probably not going to want to do anything but roll up in a ball and hide in a corner somewhere. So even walking is difficult right now. You know, to get a breath. That's my stomach. And the battle just begun. once I get some chemo, I'm sure I'm probably going to be using a walker or a wheelchair or something. So that's where we're at. Thanks for watching, and stay safe out there. If you're in your 40s, 30s, 40s, get a colonoscopy done, especially if you have a family history of cancer. I didn't do it in time, and I should have. My fault. Thanks for watching. Stay in, hang in there. See if I beat it. Thanks. Bye.
March 30th. I am out of the hospital. I got out of there on Sunday morning, I think. And I just haven't had any energy to post anything. Kind of just laying in bed. Walk back and forth to the bathroom. Outside now and then when my wife gets me motivated. Had a doctor's appointment today. And they infused into this ball here. What that does is they'll pull out a little bit of spinal fluid from the brain, put it to the side, have it analyzed, make sure if there's any cancer in it or anything. And then they'll put in a chemo liquid of the same cc's. And then I have to wait in the office for half an hour to make sure I don't get dizzy or pass out or anything. This time my left eye kind of got a little bit of sparkles in it, but wasn't really bad. Still haven't got my voice back yet. Still haven't got my looks back yet. That's gonna be a while. Got the window open. Let's see, it's 80 degrees outside today in Kentucky. And it's not going to be like that for long. Tomorrow it's getting cold. It's going to drop tonight, probably down in the 50s. So enjoy it while it's here. Let's see here. This is what I'm trying to eat, a lasagna. One of the personal size. Sorry, I'm shaky. Personal size lasagna with some tomatoes on it. I've lost a lot of muscle in my legs. Tiny, skinny little legs. Tiny, skinny little arms. Fingertips are numb. This side of my leg is numb. My belly's numb, like the surface. I don't know why. The nurse or the doctor said at the hospital that they have a medication that they can give me to help get the feeling back in my skin. But I'm worried about that because if it has to do with nerves, I'm treating nerves here. So I'll probably hold off on that. It's getting a little chilly in here. Wind blowing through. So it's sometimes hard to sleep at night because my belly, my stomach is like extremely cramped. I can eat food, which puffs it out, makes it feel a little better, but then it goes from the belly to the intestines to my colostomy bag. Now I gotta empty that. And then guess what? Now I'm empty again. Now my stomach shrinks, starts to hurt again. Can't win. So doctor gave me some tramadol 50 milligrams. I don't know if it's gonna help or not, but gonna give it a shot. And for everybody else that's watching, you know, can't wait to get my own facial features back. I don't look like myself. So that's it for now. I go back in a week and a half. They plug me back into here to my stent, or they call it a port. Plug it in, 1, 2, and they push the needle right through the skin. But I guess it's better than getting jabbed in your arm and creating all this again. So another month and a half of treatments, 4 of them. Hopefully it's a month and a half and he comes back with blood is clear, 100%. It's done. Because I believe I have non-Hodgkin's lymphoma, which I've done a little research. It says that you can completely dissolve or destroy that kind of a cancer. And the doctor is kind of confirming that with me. He's like, it's a very curable thing. So that's good. And next time here, I'll tell you another story that I just found out today from the doctor, because I didn't know what was going on the first couple of days when I was in the hospital. I was out on a respirator. So 60 minutes is long enough. I will let you know the next story as it comes. Stay safe and get yourself checked.
This video is just a little bit about update on my cancer that I had. I am clear. It's been 2 months. I had my PET scan and there was nothing that they found. So still have to do a CT scan every 3 months to verify that it's not in my system anymore. And I'll probably do that for 2 years. And the doctor here in Michigan said after 2 years, if it's not coming back, it shouldn't come back. I still have my injection site here. That'll probably stay for a little while, maybe for the 2 years, just in case it does come back, that I'll be set for it. Friday, I get this port taken out. They're gonna shoot me in the area with some local anesthetic, something like that, numb this whole area, and then take this tube that goes up into my neck and just kind of pull it. He said it should pull right out of the vein, and the vein should seal right up. Kind of scary. I'm worried about it spurting blood everywhere, but we'll see how that goes. But the things that are still affecting me are my feet. After chemo for 6 sessions, 24 hours a day for 4 days a week, every 3 weeks. The ball of my feet feel like they're puffy and like instead of just being normal size, they feel like they're extra large, and after a while they become tingly. Also, I can't snap my fingers. It's like my thumb is weird, it won't position properly. Trying to button my pants up even with both hands to get it together is difficult. So I'm hoping that will come back eventually. It's only been 2 months since chemo's done, so I'm hoping that I'll get back to normal. Sorry about the pink room, the blue room, green room, but this is just my place where we're staying right now until we get our next house.
We did move out of Kentucky, back in Michigan. Not looking forward to the snow, but we're here, close to family. Other than that, I'm doing pretty well. There is no swollen lymph nodes anywhere. The doctor checked me yesterday. Do my CAT scan on the 14th to confirm that everything's clear. And that's where I am for now. Feeling much better, just not quite as strong as I used to be. My hair is growing back. Yeah, so for everybody out there that's watching my YouTube videos, thanks for watching. I appreciate it. Like, subscribe, share. Try to get me up there with everybody else, even though I'm not the most exciting, crazy channel out there. Thanks for watching. Stay safe, and make sure you check yourself for doctor's appointments.